I mean, I remember when HIV/AIDS came out fresh, many wouldn't want to go do the test. Even now, then from HIV moved on to hepatitis. Again, people who want to do the test to get to know their status and all that. So many Ghanaians are scared to know their health status. When it comes to breast cancer, is it a condition that we need to really be afraid of? Do we need to fear it?
No. We don't need to fear breast cancer. We should rather be aware. And you see, something that we should not forget, that as a country, we have some dialects, some languages.
Okay.
Like when you
time.
You know, that goes so deep, and that, I think, is part of the problem. Why our women do not even want to know. And up to now, even educated people can tell you that I don't want to know. If I don't know, I don't know. But it's important to know and to take measures than to stay with it and, assume that there's nothing happening. At the end of the day, you still come to the hospital. Breast cancer is not an acute kind of condition. It will always show up at a point. So why don't you come early so that we cure it for you, rather than stay and come when we cannot do much
to help you.
To help.
So you keep saying that we should not fear breast cancer. I'm hoping and praying that it's going down well with people and that they'll buy into that thought and that advice. You also keep mentioning that when you pick it up early, it helps. And I know that there's stages when it comes to breast cancer. I think last week when we spoke, it was between 4 and 5, 1 to 4, 1 to 5 stages.
0 to 4.
0 to 4 stages.
Yes.
At what stage would you determine it or describe it as early?
0 to 2.
And explain that. What is 0? What is 2 to 2?
0 is when the disease is still in the ducts. It hasn't eaten out of the confines of the ducts.
Okay.
Most breast cancers start from the ducts. The ducts are structures in the breast. Those tubules from which the milk comes out. Those ones are the most common sites for breast cancer, even though there are some other sites. But when the disease has not spread from its confine, then it's an intraductal carcinoma or an intraductal lesion.
Is that the 0 part?
The 0 part.
And for you to be able to pick it at that stage, is it self-examination or you need to go to the hospital? Mammogram?
Yes.
Okay.
Mammogram is what can pick the early stage, the 0 and 1. And that's why in the high-income countries, they are able to cure breast cancer, for majority of the people, because you are called to do your mammogram. And so the disease is picked even before you yourself knows that there's something wrong with you. And that's what we think we should also be doing. Here, sometimes we pick the stage 0, but they are very few. And then also we have the stage 1 and 2, which are also things that we can cure. But it's the stage 3 and 4 that's the problem. In fact, stage 4 is our main headache.
We'll get there. So between 0 and 2, it always has to be picked up by a mammogram?
No.
Okay.
No. Stage 1 can be picked by the hands.
Okay.
Stage 2 can be picked by the hands.
Okay.
When a lesion is about 1 centimeter, it can be picked, and that's stage 1. And so up to stage 2, which is 2 centimeters, up to 5 centimeters, you can pick it easily. And that's why the clinical breast examination is very important, and the breast self-examination. You yourself should be your own advocate. You should be checking. And if you see something, you move.
How often do you have to be checking?
Every month.
Once a month?
Once a month. Every woman should check her own breast once a month. If you are still menstruating, you do it after your menses. Because before the menses, the breast becomes lumpy. For some women, it's tender. And so that's not the time to check it. After your menses, your breast becomes normal. And that's the time for you to examine them. If you are postmenopausal, you have to do it once every month. Pick a day in the month. It could be the first day of the month, the last day, whatever day, maybe your birth date, so that you will always remember. And so if you do it, the more often you do this test, the higher the chances of you knowing them, knowing how they look like and how they feel like, because everybody's breast is different. So you should know how yours are, whether they are soft or they are lumpy or whatever texture you have. If you know them, when you have something small like the seed of an orange, you feel it because you know them.
Okay.
And so that's the advice we want to give to every woman with breasts. Even if one breast has been removed, the other one should always be checked.
Okay. Now, what is the speed of infection between 0 to 2 and then from 2 to 4? I don't know whether I get my question.
I get your question.
Once you have the problem, the breast cancer, whether it's a lump or whatever you have, the speed of progression of speed to stage 4, how is it like?
I get your point. So let's get it here, that breast cancer is different for every person.
Okay.
There are several subtypes. There are histological groupings. So somebody may have a grade 1 tumor. Another person may have a grade 3 tumor.
Okay.
Grade 1 tumor means it's not very aggressive, but the grade 3 is very aggressive. So the pathway between stage 0 and 1 or 1 and 2 depends on the nature of the tumor. Some can be triple negative, which is also aggressive, and some can be an ER positive tumor, which is not so aggressive. So it's very difficult to say when your breast cancer will move from stage 1 to stage 4. For some people, you find a small tumor in the breast and it's already a stage 4.
Whoa.
It's gone already. That is why we don't have the luxury of keeping things, you know. Time is not on our side, especially when you find a problem. You have to move so that you can catch it early and treat it and cure it.
So oftentimes you say catch it early, catch it early, catch it early. And that's why I asked the questions about this stage 0 and have ended at stage 4. What happens between stage 0 and 2 when it's caught early? What happens?
Oh, if you catch it early, I mean, I don't mean the woman you feeling it early at home, but taking a prompt action, going to the hospital. So we've done the biopsy, it's proving that it's malignant. We need to do surgery, we need to do chemotherapy, we need to do sometimes radiotherapy. And then if it's estrogen receptor positive, the patient goes on oral drugs after the initial treatments. So whether we will start with surgery or chemotherapy depends on the stage and the type of disease.
Are you saying that even at a 0 stage?
0 stage, you don't, it's the harmless stage. You don't need chemotherapy, but you need surgery.
Even for a 0 stage?
Yes.
Why?
You need surgery to pick it out from where it is.
Okay.
Because if you don't, it has the tendency of spreading. So you pick it out, and because you picked it out and left the breast for the woman, she will need radiotherapy. Whenever we leave the breast, we need to do radiotherapy.
Now, how long is the radiotherapy for?
Oh, just 3 weeks.
And then you're good.
Yeah.
Is it possible that you might go through that treatment for stage 0 and then it can, come back?
Okay. If it was exclusively a stage 0, then it won't come back. But for a tumor, sometimes maybe the upper part may be stage 0, but the lower part may be stage 1 or 2, or it's already an invasive tumor. So in that case, you need the kind of surgery that we need to do, a wide local excision or a radical resection or an excision with a normal tissue surrounding it. You just don't go to the tumor and pick it alone and leave something behind.
Okay. Yeah. So that's for stage 0?
Stage 0, even stage 1 and 2, we can do that.
But you also said that you can have a stage 1 or stage 2 and it's still an advanced stage of the breast cancer.
Yes.
So would that say, in that regard, would that same treatment suffice?
No. The treatment is different for every patient. If somebody comes and has an aggressive tumor, you may have to start with chemotherapy to downstage the tumor before you go to surgery. Sometimes if it's a soft kind of tumor, harmless, so to speak, you can straight away go to surgery. And then after surgery, you do your chemotherapy and continue.
Having said this, the stage 0 to stage 2, what would you say the survival rate is like?
Oh, very high. As for stage 0, it's almost 100%. And that's what they normally have in the US, and they have about 95-98%.
What's our percentage in Ghana?
If we catch it as stage 0, we are also about that 95%.
Okay.
Yeah.
And that is why we keep saying that women should take their breast health seriously, do the checks frequently, pick it up, and then get a treatment.
Yes.
Let's now talk about stage 3 and 4. What can you share with us?
Okay. Stage 3 and 4. Let's take stage 3. It means that the tumor is big. So normally you cannot start with surgery. You have to do chemotherapy to reduce the tumor size, to make the place conducive for surgery before you do the surgery. And after the surgery, depending on the immunohistochemistry, you treat the patient. So those kind of patients, they have to do chemotherapy, surgery, radiotherapy, and hormone therapy if they are estrogen positive.
The treatment that you just ran us through, at the stage 3 and 4, is that a stage where we see the cancerous nature of the breast, where there are sores on them?
Yes.
Does it have foul smells on them?
The stage 3 can also have an ulcer, but it may be a locally advanced tumor.
Meaning what?
It means that it hasn't spread, it hasn't metastasized yet. But stage 4 means that the disease has already left the breast. So you have some in the liver, the lungs, the brain, or the bones.
So this is a breast we're talking about. What has it got to do with all those other organs, liver, bones, stuff like that?
That's the problem. That's the characteristics of every cancer, the ability to spread. And for breast cancer, the target organs are the liver, the lungs, the brain, and the bone. So if you have the spread to any of these organs, then we are talking about the stage 4 disease. Unfortunately, those people do not undergo surgery. Surgery is not.
It's not an option.
No. Unless we want to do surgery for a particular purpose, maybe to sanitize the woman, for her to at least live some quality of life, Otherwise, we don't do surgery.
For that stage, the 3, and let me even add the stage 4, in terms of the treatment, the chemos, and all those other things, what would you say the survival rate is like?
Stage 4 survival rate is very low. That will be about 15 to 20, even for a 5-year period. Sorry, because for those ones, because the disease has already spread, the cells destroy those organs. So if the liver is destroyed, how can the person live? If the lungs, for lung metastasis, we have some patients who have survived for 8 years with lung mets. Bone mets is very painful, but they too can survive for a short period of time. Brain mets is also very bad. So stage 4 is something that we should try as much as possible to eliminate from our system. And that's why we are always talking about early detection and prompt action. Go to the hospital early before the disease spreads.
Between the 0 stage through to 1, 2, 3, and 4, at what stage would a woman have to lose a breast or both breasts?
Okay, so for stage 4, surgery is not an option. But up to stage 3, we can decide to remove the breast depending on the conditions. If somebody comes with a stage 2 and the disease is not only found in one quadrant and you can find it elsewhere, then you cannot preserve the breast. We normally want to preserve the breast if the disease, the tumor, is not more than 3 centimeters. So it may be a stage 2, but then locally you feel that that's not a right thing to do, especially if the woman doesn't have big bust, because it depends on the size of the breast in comparison with the size of the tumor. If the tumor is relatively big, looking at the size of the breast, then you cannot leave the breast. It will come again. So we need to take all those things into consideration before we can decide to preserve the breast for the woman.
Now, in case you just tuned in,